Did you know that reflux, which is inadequately controlled, can lead to esophageal cancer? Hence, the importance of having regular checks, especially if you have frequent symptoms of reflux or had reflux for many years. It would be recommended to have an upper endoscopy to assess the lining of the esophagus. Hi, I am Yanez Peerbaccus, gastroenterologist based in North Brisbane predominantly. Today I want to talk to you about acid reflux, also known as heartburn. What is acid reflux? This occurs when the acid of the stomach flows back into the esophagus, which is also known as the food pipe. This happens more frequently than is expected and can cause various symptoms. And it can be frequently associated with weaknesses in the lower esophageal sphincter. What are the symptoms of reflux? Most commonly, people describe burning sensation in their upper abdomen, in their lower chest, and which can radiate into their throat, neck, and sometimes into the sinuses. Occasionally, they might regurgitate food, have difficulty swallowing food, can have weight loss, and can have chest pain symptoms which can be similar to cardiac kind of pain. They can sometimes have bleeding problems as well from severe reflux, where it can cause ulcerations. How is reflux diagnosed? The most common test that is done as a diagnostic and assessment of reflux is with an upper endoscopy, where the lower esophageal lining can be assessed adequately, and looking at the sphincter as well and the stomach lining, where ulceration, inflammation, obstruction, and other features can also be noted. Depending upon the severity, further evaluation or recommendation will be made. Other ways of assessing for reflux is when you do a swallow test through the X-ray department, where you will be asked to swallow a substance which is coated with a radio opaque metal, and X-rays are taken. What are the treatment options for reflux? Most commonly, if your symptoms are quite mild, certain measures such as drinking less caffeine, avoiding smoking, drinking less alcohol, avoiding large meals, fatty foods, and also avoiding lying straight after a large meal can help control the symptoms. If your symptoms are also infrequent, you can take certain mixtures such as Mylanta or Gaviscon. When your symptoms are more frequent, you can be advised to start some medication such as a proton pump inhibitor. Some examples are Nexium, Losec, Somac, or a histamine 2 receptor blocker such as famotidine or Zantac. If your symptoms are still quite pronounced despite all these measures, then anti-reflux surgery could be the next step.